Yeah, and that really highlights for me the importance of this kind of like whole, I don't want to say holistic, but this kind of multidimensional view of patient health, because so many symptoms overlap. Do you have any thoughts on how you see maybe even record keeping technology and things like that impacting how we see patients as a whole when they come in with symptoms that might overlap with other things? Have you kind of thought about that a little bit?
Yes, definitely, like multidisciplinary approach. So if this patient was not like approached in a certain way, we could have missed the diagnosis. And I'm happy that for hypoglycemia, because if there was no hypoglycemia, they will not call the endocrinology like to diagnose this case. I definitely agree. We should keep a multidisciplinary approach for any cases, especially this kind of suspected cases. And thank God that they saw the CAT scan. There was a tumor, which made them to call the endocrinologist on top like of hypoglycemic symptoms. So
Mhm.
I'm happy that we got into the case on the perfect time.
Mhm. And that tumor being found on the CAT scan, that was just incidental, right?
Incidental.
Yeah, wow. In looking back, were there any other symptoms, and or what would the progression of this have looked like if it hadn't been caught?
Okay. So he was gaining weight because he was hypoglycemic and he was eating well, like very, like to prevent the hypoglycemia, definitely. And he was gaining weight at the same time of depression. But this type of neuroendocrine tumors, when they involve like other hormones, they can have multiple other symptoms. But in his case, the psychiatric symptom was like very unusual presentation in this case.
It's very interesting. Wow, that's great. Tell me a little bit about your other poster.
Okay, so the other poster was about pheochromocytoma that in my fellowship I couldn't find a lot of cases, but I'm fortunate in my first year of practice I found multiple cases like when I was consulted as an inpatient, and I don't know, maybe I was like looking into the hypertension, that those are the symptoms of pheochromocytoma, and in a month of consult I got 3 cases. Those are very interesting, and I bought them in the like outpatient clinic for follow-up, and eventually we diagnosed as pheochromocytoma, and it was really interesting in a month, which I didn't see in my fellowship in like 2 years. Like 3 cases is amazing. So that's the reason like we were like to let other people know like what was the spectrum of symptoms pheochromocytoma can
Mm.
present with.
Yeah, tell me a little bit about the chromocytoma for the members of the audience, including me,
Yeah.
who's not familiar with it,
Okay.
please.
So pheochromocytoma, this is a disease of the adrenal medulla, the adrenal gland. There is 2 glands above the kidney, and these tumors arise from in those glands. But the symptoms are very interesting. They will have episodic palpitation, chest pain, or sweating, excessive sweating, sleep disturbance. But these are episodic. Some people think, oh, this could be normal, but might not be normal, that you are thinking normal but not normal. So the first case that I had, he was telling me that he sweats when he lifts heavy weight. He thought that is normal for him because he was lifting something heavy, which was like normal, anybody will sweat. But no, this was episodic while he was lifting weight, when we looked on the hind back, like when we look on the back. But the reason for this patient presenting to the doctor in an emergency room was his chest pain and the palpitation. He ignored his symptoms of excessive sweating, like when he was lifting weight. So that was like interesting, I would say.